You know, the treatment for the TMJ disorder varies from patient to patient, but we have goals in mind. We know what a healthy chewing system looks like, what nature gave us. But I think of it this way, that if you went to a cardiologist, he knows what a perfect heart looks like and beats like and feels like, and he would like all of us to have that perfect heart. And we all don't have that, but he wants us to get to as close as ideal as possible. Treating the TMJ is the same way. So we know what an ideal chewing system looks like, feels like, functions like. And for patients after their diagnosis, when we know what their particular problem might be, our goal is to get them back to the ideal chewing system, how nature intended. Well, the fix for TMJ is to get the system working how it should. The jaw joint positioned correctly, just like you'd want your knee or hip positioned correctly. To have the teeth fitting together the way nature intended. So unworn teeth that all fit together at the same time the jaw joint fits together, the muscles are relaxed, you're chewing like you should be, symptoms usually subside, and that's how we treat a successful patient, is when the bite works and they're comfortable. I think the key technology to diagnosing a patient with a TMJ disorder is all the diagnostic records we use are invaluable. But I think the most important one that you don't see every day at most offices is the technology to take a scan of the head called a CBCT. It's a three-dimensional scan, so I can literally take the patient's jaw joint, rotate it around on the computer and look at it three-dimensionally. So I really have a very thorough understanding if there's any disease in the joint and how it's functioning. You know, the process varies again from individual to individual, but the diagnostic process can be as short as a couple weeks, maybe up to 10 or 12 weeks, depending on the severity of symptoms. The treatment can be quite simple and maybe 1 or 2 appointments, or for a very complex case, it can extend out for months. So every individual is treated differently. The best thing to do is to treat patients early on in the process, because the earlier we see them, the earlier we get the patient functioning ideally, the less complicated the treatment. You know, the results can literally last a lifetime, because we're returning the body to functioning how nature intended. And Mother Nature kind of had it figured out. So I think it's very important to understand the human chewing system and to emulate that. And so that's why our treatment can last a lifetime.